This DVD is part of a series of learning products presented by the Association of Surgical Technologists, the only nationally recognized professional organization for surgical technologists and the leader in surgical technology education. The series consists of 6 DVDs that are geared toward the student surgical technologist and focus on the duties of the surgical technologist. Each DVD is accompanied by a study guide that provides supplementary information. The series is divided into 2 parts, each consisting of 3 DVDs. The first part is entitled Introduction to Surgical Technology, where the student will learn the principles of asepsis and master the individual tasks involving sterile technique. The student will also learn about basic surgical instrumentation, equipment, and supplies, as well as the concepts related to patient positioning, prepping, and draping. The second part is entitled Surgical Case Management, where the student will be required to integrate all of the information previously learned in the introductory portion of the series and apply it to the 3 phases of patient care, or surgical case management. An appendectomy procedure is used to illustrate the critical thinking activities and other tasks necessary to provide preoperative, intraoperative, and postoperative patient care. The appendectomy scenario is intended to help the student focus on organizing his or her thoughts and activities to be able to apply the learned information to management of virtually any surgical procedure.
The principles of asepsis and the practice of sterile technique are the backbone of all activities in the operating room. Within this video and accompanying study guide, you will learn the 3 principles of asepsis and the related skills needed to practice sterile technique. We have divided the necessary information into 3 sections and provided learning objectives in the accompanying study guide.
The principles of asepsis were designed to achieve a specific goal, which is to keep the microbial count within the sterile field to an irreducible minimum, thereby protecting against the transmission of disease. The 3 principles of asepsis are: Number 1, a sterile field is created for each surgical procedure. Number 2, sterile team members must be appropriately attired prior to entering the sterile field. Number 3, movement in and around the sterile field must not compromise the sterile field. Applications of the principles of asepsis are many. Application of the principles of asepsis is referred to as the practice of sterile technique. In order to provide a safe environment for both the patient and the caregiver, some preliminary information must be presented before the skills related to the practice of sterile technique are demonstrated. In this section, you will be presented information on design of the operating suite, areas of the operating suite, ventilation system, OR furniture, OR attire, the surgical team members and their roles, sources of microbial contamination and their modes of transmission, and standard precautions. Operating suites are designed to separate clean and dirty traffic patterns and provide each OR with the necessary supplies before, during, and after each case. The basic layout of the operating suite may vary according to the age of the facility and the physical design of the areas outside the operating suite. One common plan is the peripheral corridor or the racetrack plan. Only authorized individuals may enter the operating suite. Areas of the operating suite include the non-restricted, semi-restricted, and restricted areas. Authorized personnel in street clothes may enter the non-restricted areas of the operating suite. These areas may include the admitting pre-operative holding area, locker rooms, and the post-anesthesia care unit. OR attire such as scrubs, hair covers, and shoe covers is required in the semi-restricted areas. The semi-restricted areas may include the control desk, offices, corridors, and instrument workroom. Additional attire, such as a mask, is required in the restricted areas. The restricted areas include the operating rooms, storage rooms, scrub sink areas, and sub-sterile rooms. The flow of traffic in the operating suite revolves around the desire to prevent surgical site infection by separating clean and soiled work areas. Patients and staff enter and exit the operating suite through either non-restricted or semi-restricted areas. The surgical procedure and related sterile functions occur in the restricted areas. The ventilation system in the operating room provides a one-way airflow pattern and maintains positive air pressure within the operating room. Clean filtered air enters the operating room through vents in the ceiling, flows through the room, and exits through vents in the lower wall. This is referred to as laminar flow and is the preferred ventilation system. Furniture and equipment typically found in the operating room include the operating table, anesthesia machine, anesthesia cart, X-ray view box, prep stand, back table, Mayo stand, ring stands, single and double, kick bucket, OR lights, outlets, IV poles, hypothermia unit, suction canisters, electrosurgical unit, fluid and blanket warmer, Although the steam sterilizer and the Steris are located just outside the operating room in the sub-sterile area, they are vital pieces of equipment that merit mention here. Operating room attire is worn in the semi-restricted and restricted areas to protect both the patient and the staff by keeping the microbial counts to a minimum and limiting microbial spread. Three types of attire are required to enter the operating suite and perform various functions. OR attire consists of the scrub suit with the drawstrings tucked in, hair cover, must cover all head and facial hair, knee-high boots or shoe covers may be optional according to facility policy. Additionally, use of makeup and wearing of jewelry may be restricted. A mask and eyewear may also be required according to facility policy. Protective attire consists of a mask and face-eye protection. Additional items, such as radiation protection devices and laser eyewear, may also be necessary. Scrub attire is worn within the sterile field and consists of the sterile gown and gloves. Surgical team members function in two capacities, non-sterile and sterile. The non-sterile team members are the circulator and the anesthetist. In certain situations, other personnel such as a radiology technologist or pathologist may also be present. The circulator is either a registered nurse, RN, or a surgical technologist functioning in an assistive circulating role, STAC. The circulator performs many duties throughout the patient's operative course. Some of the circulator's duties include direct patient care, assisting the anesthetist, providing additional items to the sterile field during the procedure, and maintaining the patient's operative record. The anesthetist may be either a physician, MD or DO, or a certified registered nurse anesthetist, CRNA. The function of the anesthetist is to administer the anesthesia, monitor the patient's vital signs, and provide any supportive measures during the surgical intervention. The sterile team members are the surgical technologist in the scrub role, STSR, the surgeon, MD, DO, DPM, DDS, and the surgical first assistant, physician or non-physician. The STSR functions in the sterile capacity during the surgical procedure, but also performs many non-sterile duties throughout the course of the workday. The main sterile functions of the surgical technologist are to create and maintain the sterile field, enter the sterile field and assist team members as they enter the sterile field, organize the sterile instruments, equipment, and supplies for use, assess and anticipate the needs of the patient and surgeon throughout the procedure, and provide the necessary items in order of need. The surgeon performs the necessary procedure. The surgical first assistant assists the surgeon by providing visualization of the surgical site through retraction of tissue, suctioning, and sponging, assists with achieving hemostasis and suturing body planes, among other duties. Sources of microbial contamination include personnel, the environment, and the patient. The modes of microbial transmission most likely to occur in the operating room are contact, direct and indirect, and airborne. Droplet contamination is considered an airborne mode. Standard precautions are used to prevent the transmission of disease. The main concepts are: all individuals are considered potentially infectious, whether they show signs of disease or not. Blood, all body fluids, secretions, excretions, with the exception of sweat, non-intact skin, and mucous membranes are considered potentially infectious. Disease transfer in the operating room most often occurs via the following modes. Airborne, droplet transmission is considered an airborne mode. Contact, direct or indirect. Other modes of transmission not common in the operating room are presented in the study guide. Appropriate attire and personal protective equipment must be worn. Protective techniques must be employed: hepatitis B vaccine, safe handling of sharps, proper care and handling of specimens, decontamination of the physical environment, including handling of laundry and waste disposal, equipment and instrumentation, frequent hand washing. Hand washing, as it pertains to standard precautions, is performed frequently throughout the day. Before reporting to the workstation, before leaving the workstation, before and after personal hygiene, before and after direct patient care, anytime the hands become soiled. The basic hand wash differs from the surgical scrub in both theory and technique. Hand washing is performed to remove gross debris and transient microorganisms from the hands and wrists and to decrease the risk of transmission of disease. An effective hand wash may be performed at any sink, requiring only soap and water to be effective. The hands are dried with paper towels and are considered medically clean following the procedure. The procedure for a basic hand wash is as follows. Inspect hands and wrists to ensure that the skin is intact and the nails and cuticles are trimmed, and to note any areas grossly soiled that may require special attention. AST recommends that nail polish and artificial nails are not to be worn. Note, the surgical technologist may be restricted from certain activities if the skin is not intact. Turn on faucet and adjust water to a comfortable temperature. Wet hands and wrists. Be sure that the body and clothing do not touch the sink. Apply an adequate amount of soap. Lather using moderate friction and a circular motion. Be sure that all surfaces, including the fingers, web spaces, hands, and wrists, receive adequate soap and friction. Use nail cleaner brush if necessary. This step is not necessary in most situations, and need is determined by the amount of visible soil present. Interlace fingers to facilitate cleaning between the fingers. Hand wash should last a minimum of 30 seconds to 1 minute unless the amount of visible soil requires more time to remove. Rinse, keeping hands pointed downward to avoid splashing water. Turn off water. Obtain towels without touching dispenser. Use patting or blotting motion to dry to reduce friction and drying of skin. Discard towel in waste container. Apply lotion if necessary. Continue with duties as needed.
The skills that you are about to learn are divided into subsections that relate to each of the 3 principles of asepsis. Key concepts that relate to each skill are presented in the study guide that accompanies this video. Keep in mind that product differences and school or facility policy may dictate a variance in technique. Regardless of method, the principles of asepsis must be applied and sterile technique must be practiced. The first subsection of skills that you will see relates to the first principle of asepsis. A sterile field is created for each surgical procedure. Each of the following skills pertains to the establishment of the sterile field. The back table is used for storage of sterile items before and during the surgical procedure. The back table pack is typically the first item that you will open when establishing the sterile field to allow the necessary movement around the back table. The procedure is as follows. Check integrity of outer wrapper. Remove dust cover. Check integrity of inner package. Orient pack on back table. Break or remove seal. Unfold the first flap away from you. Unfold the second flap toward you. Remove any accessory items, such as the separately packaged gown. Place the gown on the Mayo stand. Position yourself at the right side of the back table to open the third flap. Insert your hands under the cuff. Extend the drape to cover the table. Excess material is allowed to drop below the table level. Move to the left side of the table and open the final flap.